Now to that potentially deadly respiratory virus. MERS is on the move this morning. The very first case transmitted right here on U.S. soil. ABC's Steve Osunsami has the very latest and joins us from CDC headquarters there in Atlanta. Good morning, Steve.
Good morning, Robin. Investigators here at the CDC say they are still not 100% sure how this disease is spread. It's the first known transmission of this potentially deadly respiratory disease on U.S. soil. An Illinois businessman testing positive for MERS on Friday. His first test was negative. He never felt sick. Doctors had already sent him home for 2 weeks and then cleared him for travel when they discovered that his body had fought and killed the virus. Here's how they think he caught it. He had extended face-to-face contact with patient number 1, an Indiana man who flew in with the disease from Saudi Arabia. They had 2 40-minute meetings, sat 6 feet apart, and shook hands. Health officials are watching anyone who had close contact with both men.
We're offering the opportunity to be tested and reassured and excluded.
The CDC says it's still much easier to catch the flu or the common cold, telling us most new cases will still come from the Arabian Peninsula.
Travel season to the peninsula is about to kick off. We've got pilgrimage holidays and Ramadan coming up at the end of June.
This morning, health departments in at least 30 states are working with federal health officials to track down passengers who shared flights with patient number 1 and patient number 2, who had to be hospitalized in Orlando. Both men flew from Saudi Arabia. They underline that this is a new disease, that it isn't terribly contagious, but it does kill. More than 160 people have already died from this, most of them in the Middle East. Robin?
We do have to keep that in mind, Steve. Thank you. For more, we turn to Dr. Richard Besser, who, as you know, spent many years there at the CDC. In fact, that's where you were before we were lucky enough to have you join us. Remind us again what MERS is.
Yeah, so it stands for the Middle East Respiratory Syndrome. It's a respiratory infection that can lead to pneumonia. And the concerning thing is that up to a third of people, 30%, can die from this infection. And
the concern about it spreading here in the U.S., where's that? Where does that stand?
Yeah, I mean, this weekend, it was really a big turn in this investigation. The concerning thing is the person who got the infection only spent 40 minutes with the infected patient, 40 minutes face-to-face and a handshake. That's very concerning. The encouraging thing is that although he was infected, he didn't get sick. His body fought it off.
But we don't know if that's the norm, and I know that has to be of concern.
Yeah, I talked to CDC last night, and until they answer the question, can this person without any symptoms spread it to other people? How serious really is this infection? Could there be a lot of people who get it but have no problem? Till they answer that, they're going to be all over this.
And they're going to, yes, they're going to stay on it. All right.
Definitely.
Thanks so much.